Hi, I'm Jackie and Jacob with The Scoop, and we're here with Dr. Brandi Sinkfield, who is one of the people who is interning here and is helping out with taking care of the e-patients and really everyone's health need, and also moderated an amazing panel earlier today. So tell us a bit about your work.
So I'm a practicing anesthesiologist who is interested in digital health. So I had an opportunity last year to attend Madison and was very much inspired by the stories and a lot of the breakout sessions, and decided to pursue a fellowship in digital health that's run by Dr. Larry Chu and Dr. Bassam Kadri. So I'm here really to learn more about how to transform health and how these emerging technologies can be used to make the healthcare experience better for patients.
So what is the most interesting conversation you've had here at Madison X?
Well, I think certainly all of the stories of patients. The one thing that I truly enjoy is all the unique ways in which patients really tell the stories beyond what happens when we see them in the hospital. For instance, one of the ideal challenges, one of the panelists talked about the signs that she wanted to basically use in the clinics, and one of them was the question of, will this affect my sex life? Which I think it definitely helps the patient and the physician, or the physician to understand that we're talking about human beings here, and life does go on after they close the door and leave the clinic. So I found that certainly humorous, but also reality checking for physicians who are also humans too.
And you touched on a really interesting point here, which was the IDEO workshop with the e-patients. So enlighten us a bit about what was that all about?
The IDEO Challenge is run by Dennis Boyle, and he allows patients, clinicians, investors, people from all different perspectives to brainstorm and come up with relevant questions and come up with relevant actionable solutions to very common questions that seem to sometimes go unanswered in healthcare. So it gives them, a lot of times, if you talk to Dennis, these idea challenges can take months and days, but I think what's unique about Madison X is we sort of compress that experience into one day. And it's amazing because when I was listening to the e-patients speak, these were very invaluable lessons that were learned not only by them, but by all that were involved in that experiences. There were many thoughts that were not expressed, that cannot be expressed in a 15-minute clinic, or can't even necessarily be expressed in a 30-minute conversation with a family member. So I think that the e-patients are going to really provide a more invaluable role moving forward in terms of directing clinicians and others involved in healthcare.
I did hear maybe a little tidbit about having to fix a prosthetic leg on the fly.
Yeah, actually one of our e-patients here does have a prosthetic limb, and I got a phone call yesterday morning saying that the limb was, we're having some issues trying to make sure that it was working properly. So we did have to find some resources to help rectify that, and we're currently still trying to help him get the right resources so that he can be active again. It's an honor to take care of e-patients here.
Wow, well, thank you so much for giving us your time. For The Scoop, I'm Jackie Andraka.